like to call Kowalski to the stage to present her with the Francis O'Brien Award for Addiction Services. The Francis O'Brien Award for Addiction Services recipient must demonstrate a personal long-term commitment to the goals of ABH and provide leadership and support to the association, members, staff, and mission for addiction prevention, treatment, and quality management. This year's recipient is Kowalski, Area Director of High Point Treatment Center, Brockton. Kowalski is the Area Director for High Point Treatment Center's Brockton Meadowbrook campus, which encompasses overseeing 3 separate programs on one site. She is one of the few people still working in the addiction field who knows firsthand experience how far we've come since the early 1970s. Carol actually began her career in the substance use field over 40 years ago in 1973 when she and the program director, David Mulligan, opened Catholic Charities Detox in Brockton. She was the first nursing director there and was later promoted to program director when David left the position. She remained at Catholic Charities for 41 years. In 2004, Catholic Charities decided to close their detox, trying to restructure their company. And I was very impressed that Carol, in the middle of a crisis, reached out to me about trying to save the detox in Brockton. And I was a little taken back because Catholic Charities and Brockton Detox had a long, rich history of providing services to the community. But the decision was made, and they were told as a staff, they basically had 30 days to close down and look for new jobs. Instead of panicking, Carol actually decided, you know what, after 31 years and in the middle of an epidemic of more folks needing addiction services than ever, she wasn't going to allow that to happen. And she reached out to me at High Point and asked if we would come in and keep the detox open. Within those 30 days, we were able to put together a plan with Carol's leadership to save the detox and continue services without any loss of staff or closing of any beds. In fact, a couple of months after the detox moved over to our organization, we were fortunate that Carol was able to expand the program and add a second unit to provide CSS services at the facility. Though Carol is celebrating her 10th year with High Point, she has been with formerly Brockton Detox for a total of 41 years. She has demonstrated time and again her willingness to meet the challenges that come her way. She has assisted the organization in expanding its service in Brockton, which includes a full continuum of addiction treatment services for men, women, and teens. But Carol's contributions to the substance use field go beyond her efforts at High Point. Carol is a certified addiction registered nurse and currently a member of the committee of the Board of Registration and Nurses Substance Use Rehabilitation Program, which monitors nurses in the recovery. She is also a board member of the International Nursing Society on Addictions and twice helped to set up a Massachusetts chapter of International Nursing Society on Addictions. She serves on the board of the Brockton Mayor's Opioid Overdose Prevention Coalition. Furthermore, Carol has been involved with many state organizations to promote high standards of care in addiction medicine, including both ADA and ABH. She has sat on the boards of professional nursing organizations like the Massachusetts Nursing Association and the American Nursing Association. Her consistent expert input and diligence set examples for all nurses. Carol impresses everyone who comes in contact with her on her managerial style and professionalism. She is always congenial, possibly possessing the ability to work well with colleagues and peers. Carol is a team player and is helpful to everyone. She exemplifies professionalism, appearance, action, and resolution. Carol's well-organized approach to problematic matters has styled her as a troubleshooter whose opinions and authority are sought after and respected. Carol embraces the characteristics called in the Francis O'Brien Award and is deserving of this award to her interactions with clients, staff, and colleagues, as well as her willingness to share her many years of expertise. On behalf of the Association of Behavioral Healthcare, the Board of Directors and its staff, it is with great pleasure that I present Carol Kowalski with the Francis O'Brien Award in Addiction Services. Congratulations.
I thank the association for this great honor. I thank Lee for those very nice words also. After 40 years of working in this field, I believe I am the living proof that dinosaurs still roam this earth. As Daniel said, in 1973, I was lucky enough to come in contact with two people, David Mulligan and Edwina Martin. David was the original founder of the Brockton Addiction Treatment Center before he moved on to become the Commissioner of Public Health, and Edwina Martin was instrumental in bringing self-help groups to the community. And these two mentors believed that there was no person who could not improve the quality of his or her life despite the crippling effect of addiction. Looking back to those early days, the climate was much different than it was today. Those were times when no one even knew what the term detox meant. It was not a familiar term as it is now. And they had just changed the law in Massachusetts so they could no longer arrest anyone for drunkenness. So the police, the local hospitals, public looked upon us very skeptically. Substance use disorders were just being recognized then as a disease rather than a criminal justice problem. In those early days, we persevered, however, led by the belief that more can be accomplished simply with kindness and acceptance. Our clients were people who've been cast aside because of the stigma of their illness, and unfortunately that stigma is still there today. But people who were used to closed doors were now received with an open welcome and an accepting face. We were very passionate in those early days. We thought we could save the whole world. And that quickly changed, however, to perhaps maybe we can save just the state of Massachusetts. And then our focus lowered a bit more, and we bravely thought we could make an impact on the city of Brockton. But finally, with tempered zeal, we realized that what we taught our patients, one day at a time, we needed to apply to ourselves, one patient at a time. And that's how we learned it was done, providing hope and recovery, one patient at a time. So today, I want to thank the wonderful staff at High Point, especially our CEO, Daniel Mumbar, for keeping our Brockton program open when it faced closing those 10 years ago. But as we all know, Daniel's expansive vision and steady leadership has been pivotal, advocating for behavioral health issues throughout the state. So we thank Daniel. I don't see this as a personal award, but a reflection of the work and dedication and passion all of us here have for this field. So I want to thank you all for your collaboration and friendship over the years. I also want to thank my family, not only for their support, but also for their contribution to my life's work. My husband, Carl, for advocating for programs at the college in which he works. My daughter, Chrissy, for her efforts to educate her dental colleagues on the danger of overprescribing. And to my son, Craig, for his work, albeit on the other side of the street, prosecuting drug traffickers. I also want to thank those patients over the years that have allowed me the privilege of witnessing their struggles and their recovery. I believe people come into our lives for a lesson or a blessing, and I have been taught and I have been blessed, and I thank you all very much for this time.
Good.
I'd like to ask Jackie Moore and Carla Sacconi to come up for our last award of the day, the Kowalski Cutchin